The United States has crossed a deeply concerning threshold in 2025, with more than 700 confirmed cases of measles already reported just 4 months into the year. This staggering number, released by the Centers for Disease Control and Prevention (CDC), paints a worrying picture of how quickly a once nearly eradicated disease can return under the right conditions. The majority of cases, 97%, have occurred in individuals who are either unvaccinated or whose vaccination status is unknown. That statistic alone is a chilling reminder of how critical vaccination remains in preventing the resurgence of highly contagious diseases. At the heart of this growing crisis lies a potent mix of vaccine hesitancy, misinformation, and declining public health infrastructure. Measles is one of the most contagious viruses known to medicine, with a single infected individual capable of spreading the virus to 90% of unprotected people close to them. Unlike other illnesses, measles doesn't need a sneeze or cough to travel far. It can linger in the air for up to 2 hours, infecting anyone who happens to pass through. This makes it particularly dangerous in crowded public spaces like schools, airports, and shopping centers. That danger is not theoretical. Hospitalizations are rising, with 79 reported so far, more than half involving children under the age of 5. Tragically, 2 children have already died in Texas, a state that is currently the epicenter of the outbreak. One of them, an 8-year-old girl, had no underlying health conditions. These deaths are not just statistics. They are preventable tragedies, stark reminders of what is at stake when public trust in vaccines erodes or when access to healthcare is limited. Gaines County, Texas, has become a grim focal point, with more than 350 cases alone. The speed at which the virus has spread within this community is a textbook example of how vulnerable populations can become flashpoints when immunity drops below critical thresholds. Public health officials are struggling to contain the outbreak, but when immunity gaps exist, whether due to misinformation, mistrust, or logistical barriers, containment becomes exponentially harder. Even more alarming is the demographic breakdown of infections. Nearly a third of cases involve children under 5, the very age group that is most vulnerable to serious complications from measles, such as pneumonia, brain swelling, and long-term neurological damage. Another 38% of infections are occurring in children and teens aged 5 to 19. These age groups are supposed to be covered by routine childhood immunizations, meaning either vaccinations were never administered or their efficacy has been undermined by incomplete dosing or poor record-keeping. While many might assume that having received an MMR, measles, mumps, rubella vaccine in childhood guarantees lifelong protection, the truth is more nuanced. In some rare cases, immunity can wane, especially if only one dose was given. Boosters can help reinforce immunity, but only if people are aware and follow through. The larger issue, however, remains the number of individuals who have opted out of vaccination entirely or who remain uncertain about their status. The consequences of such uncertainty are now manifesting across multiple states. The trajectory of 2025 is especially troubling when viewed in context. The total number of measles cases in 2024 was 285, a number that seemed high at the time, but is now dwarfed by the more than 700 cases so far this year. If the current pace continues, this could become one of the worst outbreaks the U.S. has seen in decades, reversing years of progress made through nationwide vaccination efforts that had once nearly eliminated the virus. This is not just a public health issue, it's a societal failure. It reveals how quickly fragile health victories can unravel when complacency sets in, when misinformation outpaces science, and when community protection is undervalued. It also highlights the critical need for renewed public education, targeted outreach, and supportive healthcare systems that ensure vaccines are accessible and trusted. There is still time to mitigate the worst outcomes. Increased public awareness campaigns, school vaccination enforcement, and swift public health interventions can help slow the outbreak. But those efforts must be accompanied by a cultural shift back toward valuing science-based healthcare and community responsibility. Vaccines are not just a personal choice, they are a collective safeguard. As of now, the warning signs are clear. The U.S. is facing a growing measles crisis that could deepen if immediate action isn't taken. The deaths and hospitalizations already reported are heartbreaking, but they could be only the beginning if current trends persist. For a disease that science has the tools to prevent, allowing it to spread unchecked is more than tragic, it's unacceptable.